Hello everyone, so I had a first video regarding the ACL. So this is what we call the hinge brace to keep your legs straight and not to, for example, rupture the ligament. As you can see, it's more like a medieval torture chamber, but it's important to wear. I always wear it when going to bed. Because that's important, because subconsciously you don't know if you're turning over and so forth. So let's just have a look at the leg. As you can see, when you're opening it up, it does take a little bit of time, but you do need to keep it as straight as possible. So I'm just opening it up for you to see now, and it's like a revelation of the leg. So, I recently had a problem. As you can see, I've got quite swollen ankles, and I'm also retaining quite a lot of water. I had to go to hospital to make sure I didn't have a DVT, which is a blood clot, as I recently got tested to see. I had a positive result in a blood test, but sometimes that can come out as a false positive response, so especially in the first couple of days before surgery. As you can see, this is the 7-day picture. Recently had, in the past I had an MPFL reconstruction here, which is a medial patellofemoral ligament, which is attached to the kneecap, which is a patella, to create lack of dislocations or stability of the kneecap. So these are the actual holes, so this one and this large one here was for the ACL, and I think this one was like a tester for the anterior lateral ligament. It's a new ligament where it is being suggested that it does have effect on the pivot shift effect alongside the ACL. However, I didn't need the anterior lateral done, which is the ALL ligament, because it was intact. So, looking at the leg, you can see I have quite a lot of bruising down it, but that is normal because gravity plays its part. They say that I am retaining a lot of fluid. You can see that from the feet. So yeah. I'm working on close kinetic workouts, so for example here, I'm just making sure the kneecap is working and holding the quadriceps static for 10 seconds. So I'm doing things like this and keeping it as strong as possible. I mean, the one thing I would say to anybody having an ACL reconstruction is the more that you can do before the surgery. What I mean by that, going to the gym, using a leg press, leg extension, leg curls, hip abductors, adductors, squats, anything you can do to make it stronger. You will notice your quad here will be less weaker after surgery. So this is only a week after surgery, and I was in the gym near enough every day, concentrating on the quadriceps, the VMO, which is this muscle here, to make sure it was as strong as possible. And as you can see, it still actually retained a lot of its strength. So I'm just dealing with a lot of the issue of the swelling right now, which is with cryocast, rice in it, so forth. Sorry about the hairy legs. So yeah, and also because I'm hypermobile, I have an allograft ACL. What the reason for that is when you're hypermobile, your ligaments don't have certain collagen protein to make them strong, so they're very lax. So you're better off, if you are hypermobile, to go with an allograft, which is donor tissue. An autograft is your own tissue, which I suggest, probably from my experience being hypermobile, you'd probably be better off with For example, the allograft, which is a donor tissue. So as you can see here, I'm starting to get some blisters, which is normal because of the fluid retention. I got that also previously in the MPFL surgery. But luckily enough, I got cleared today of any blood clots, which, woohoo, let's celebrate. And so that is day 7. And as we can tell, we will end on a few motions of quadricep holds. Always holding it for 10 seconds. You can see it shaking as well, which shows it's working the muscle. So, any questions on this, please post to me, guys, and I'm sure I'll answer them. But look at that beauty. I love that bruise right now. It's a bit like a Picasso painting or Monet, but at least it's hidden by the brace. So, I will do another video, probably, I'd say in about a couple more days, 4 or 5 days, just to show you how I'm getting on, and then without the plasters on it, so then that way you can see what it looks like underneath. So there we go, guys. Welcome to ACL post 1 week.